Yes, let me introduce you to our long-standing expert, Dr. John Van Slate.
Hey, Steve-O, good to see you today.
Gosh, when we discussed what we're going to be talking about today, John, I was like, gosh, that was our biggest show. Do you remember doing this show?
I
Talking
do.
about
Yeah,
yeah.
I
Oh
do.
my gosh.
Yeah, and I remember you were telling me about that, so I thought, man, it might be good to do this again and maybe bring in a few other things that are new. So that's kind of motivation.
Absolutely.
Yeah.
John, it's so easy doing the show with you. It's not only your knowledge, but your personality. How do you keep up with all the new things that are happening?
Well, it's really education, Steve-O, and I know we've talked about that a lot. You know, in dentistry, things change so rapidly, and I tell people all the time what I learned in dental school. That almost nothing I learned is the way we do things now. So you have to stay on top of it. You got to be educated, and you have to be really good at just keeping up with things.
So we're going to be talking about new things going on in dentistry. Let's just jump into it. Tell
Sure.
us about some of the new happenings in dentistry.
Well, you know, we briefly touched on a little bit about the video AI software that's coming out now, and you know, this has really been interesting for me because what this software does that we've never really had in dentistry before is this company uses our digital radiographs now to find things like dental cavities, to find buildup. They can find bone loss. And so it's like having another dentist in the room. It actually gives you another set of eyes to kind of confirm things that you might be seeing, especially those gray areas or those areas where you're not sure are you really seeing decay on an x-ray, but this picks it up. And you know, I got a little picture. It's kind of interesting, but this is the kind of readout that I get on this, and you can see how it'll show you exactly where the cavities are. And this is the bone loss. So it's really an interesting tool, and it's really taken us to another level in our care because, you know, in dentistry, you want to catch things early because catching things early saves people a lot of money, pain a lot of times, and things like that. Because with this technology, we're able to see things we probably would have neglected had we not had this. So I really, really am thrilled with this new technology, and we use it every day, all day on all of our radiographs now.
Is there a rule of thumb with brushing your teeth?
I would
Before they
say
go to bed?
that you want to brush at least twice a day, Steve. You want to be water flossing or flossing at least once a day, and mouth rinsing daily. That should be the bare minimum for people. But it always amazes me some of the most important times to brush are going to be right before you go to bed, because what you're doing is whatever you've eaten throughout the day is just going to sit in your mouth for those sleeping hours. So I'm amazed at some people who neglect brushing before they go to bed. But I would say a minimum should be twice a day, and certainly brushing every time you have anything, anytime you eat or eating something sugary. You can't brush enough, right? I mean, brushing is you know, more than you need is better.
You know, John, I remember the last time we talked about this, you talked about how you can heal cavities.
Yes.
And can you tell us more about that?
I can. I'm glad you brought that back up too, Steve, because this is a product called Curadine, and it's a new product. You know, it's been used a lot in Asian countries, been used a lot in the European countries. We just got FDA approval at the beginning of this year. So we've been using our practice for about 8 months. But it's a very simple product to place. It's like a gel. It takes about 5 minutes to put on. No anesthesia is needed. But what it is, this gel has an affinity for weakened enamel, and it acts like a scaffolding where it just kind of binds to the tooth, and then the natural phosphates and things, calcium in your saliva, bind to it, and literally can remineralize broken down enamel. Now the key is you have to do it on early cavities. If the cavity is already too deep, you can't use this material. But it's great for those cavities, small cavities between the teeth, because anything that's going to prevent me from having a drill between the teeth down and going through a lot of healthy tooth structure is just a huge win-win-win. And we were talking about my AI earlier. Well, that artificial intelligence is exactly good for that, because it'll find those early lesions where I might be able to use this Curadine to heal. And so they go hand in hand. And this could be a game changer, because, you know, us poor dentists, we're doing everything we can to put ourselves out of business. Now we got something that might be able to just eliminate cavities, but it's a big deal, and it's exciting for us in the dental world. And we've been wanting this for a long time. We're finally able to provide it for our patients.
Is there any news that you can treat or heal gum disease? Because that's
Yeah.
really big too.
Something like that. Well, you know what? I will tell you this. Gums, again, the best thing you can do is get regular checkups, get your dental cleanings done. Again, periodontal disease is something you want to catch early, okay? And regular cleanings is the best way to do that. But there is a product that we've been using for actually a few years now called Perio Protect that has been phenomenal for my patients. And what this Perio Protect is, it's also a gel that you apply on these trays. And I got a tray right here. You apply it in this tray, and the tray, this is a Perio Protect tray that we get from Perio Protect. It has a seal on the top, this little special design seal that's got kind of a hydrostatic push that push the gel deeper in the pockets, literally kills the bacteria that causes periodontal disease. We've never had anything like this, and it'll reach areas where brushing and flossing don't reach. So I think it's as important as brushing and flossing your teeth, but you got to use it 15 minutes a day. That's the key. So you got to find those 15 minutes to do. And like me personally, I use it in the shower. I'll put the gel on, go into the shower, take it off. But this gel, anybody who has bleeding gums, anybody with existing periodontal disease really needs to have these trays, because it's the only thing they can do at home to kill the bacteria that's causing their problem. And I'll be honest, once you get to be about 50, about 95% of people are going to have periodontal disease somewhere in their mouth. So it helps everybody. But that's the Perio Protect, and we're doing a lot of it right now, and I'm seeing results with healthier gums like I've never seen without these trays. It really helps.
John, tell people what can happen if they don't take care of their gums.
Well, of course, periodontal disease, just by definition, that is bone loss and the gums wearing away from the gums, recession, gums, and inflammation of the gums. So always, if people don't take care of their gums, you got to realize it's a progressive chronic disease. It doesn't slow down. It just keeps on going. And once it starts, it's hard to stop that engine from running. And so it ultimately can lead to bone loss and loose teeth. And so we don't ever want that to happen.
You just showed us an impression before, but is there something dentists are using now instead of those messy impressions?
Yeah, and I've got this little guy. I know last time I didn't have this up, but I'm gonna try. This is called an iTero. It's a digital scanner, okay? And I didn't show you this last time, but this little digital scanner, it's like a video camera. You put it in the mouth, and you go around the mouth, and it makes an image that looks like this, okay? And what I can do with this image is I can then email it to my lab, and the lab has a perfect model to make crowns, to make partials, to make bridges, sleep appliances, bite guards, anything. And the beauty of these things, number one, you don't have to use the impression material, the gooey stuff you're talking about, but the accuracy is unbelievable because there's no distortion like you get in an impression. This is an actual mirror image. And so the restorations we're getting back are just remarkably better, take less adjustments, easier to put on. And I couldn't live without my digital scanners now, but it's a phenomenal piece of equipment. I've been using mine now for probably well over 10 years, but the improvements in them have gotten so great. The capabilities we have, you can do them so quick now. Like I can make this scan in probably less than a minute, and that means they can get their restorations quicker, better fitting, and again, I couldn't do without this piece of equipment.
God, I hear laser when it comes to dental. There's got to be so many things you're doing with laser now. What do you do in your practice? What do you do with laser?
Yeah, well, lasers we use lasers all day, every day in our practice. And I know we've had shows where we've talked a little bit about lasers too, but the lasers, everybody that comes in our practice and gets a cleaning, we do laser cleanings, Steve, where you're going to use a laser for laser bacterial reduction. What that means is that the beauty of the laser is it literally kills bacteria. And the scalers that we use and the ultrasonic scalers that we use are great for removing stain and buildup and things like that, but they don't really kill the bacteria. So we can use a laser to go below the gum tissue, completely painless. That it spreads out like a flashlight under the tissue, and it kills bacteria, not by the hundreds, not by the thousands, but by the millions. It will kill the bacteria. We get an effect that lasts almost 3 months before the body builds up that bacteria count again. So it is great for gum tissue. We use it a lot, though, in periodontal therapy, a non-surgical, to eliminate pockets. It used to be we had to have surgery that, you have to have stitches. It could be bleeding and things like that. It can be more painful. Completely painless now to heal gum tissue using this with no surgery. So we use it all the time for that. I use it a lot to sculpt and recontour the gum tissue, because when we want to smile, we want all the teeth to be proportional to one another. And so there might be areas where the gum is unlevel. So I use a laser to painlessly and non-surgically just level the gum tissue to make people have a more pleasing smile. Ulcers, we treat ulcers and herpetic lesions with them all the time. So if people come to me and let's say they have a sore or an ulcer in their mouth, I can hit that with a laser and almost immediately the pain will go away and it'll heal almost twice as fast just using the laser. So there's tons of applications. Tongue ties, I can release tongue ties, non-surgical, no bleeding, no stitches. It's really, the lasers now in dentistry are great. I mean, we're using them a lot.
And, I don't want to end the show at all without talking about TMJ.
Absolutely.
Is there a lot of new technology out there now with TMJ?
Well, I tell you what, I've been treating TMJ in my practice for 20 years. As you know, we've done several shows on this as well. But the game changer for me is when I use the computer technology to find the bite position for the jaw. What that means is most of our TMJ pain is caused from the muscles that support the jaw joint. In other words, if the jaw's in a bad place and the muscles don't like that, we get inflammation, we get soreness in the jaw joint. So what I use this technology for is, here's a good picture of it. I use this little guy right here where I can place leads on muscles around the head and neck. It's kind of like an EKG of the heart, What I do is I can hook that up to a computer and I can find a position where the muscles are at rest and where the joint is in its most optimal decompressed position. When I find that spot on the computer, I can take an impression there and I can then devise appliances that will place the joint in its optimal location. Much better than a conventional bite guard, which is really arbitrary. Some people get bite guards that are never comfortable and the jaw joint and the muscles never like that position and they can actually get worse just in a standard bite guard. But this orthotic, very, very precise. It really puts people where the joint wants to be, in their most comfortable position. And it is absolutely, once you start doing these kind of procedures, again, use the computer. It's now an objective thing. It's not subjective. In other words, it takes my guesswork out of it when I'm treating these cases.
Wow.
I've had incredible success with it.